Hi, I am Dr. Krishna Mohan, working in Virinchi Hospital as Senior Consultant Gastroenterologist. Today I would like to share regarding jaundice. What are the causes of jaundice, why it occurs, and what should be the treatment of the jaundice. Jaundice is usually occurs due to the red blood cell degradation, which is converted into the bilirubin in the liver by hepatocytes and is excreted into the gastrointestinal tract and is excreted in the form of urobilinogen and stercobilinogen. So, why jaundice occurs? Jaundice occurs usually because of jaundice is detected when the serum bilirubin level is more than 2.5. The earliest manifestation of jaundice is lack of appetite when there is no jaundice, weakness. Then the earliest change you see is dark colored urine. Then subsequently there occurs yellowish discoloration of the sclera and as well as the skin when the jaundice is deepens. That means it is directly related to the amount of bilirubin in the blood. Then what are the causes of jaundice? Jaundice can be occurred in three types, that is called pre-hepatic and hepatic and post-hepatic. The pre-hepatic causes are usually because of degradation of red blood cells, which is caused because of hemolytic anemias like hereditary hemocytosis, sickle cell disease is the most common, and thalassemias, and sometimes it is rarely G6PD deficiency. The infection which causes jaundice is malaria. Malaria also can cause jaundice. Next, some drugs and some toxins can cause jaundice, pre-hepatic type of jaundice. Then the second form of jaundice is because of injury to the liver, that is injury to the hepatocytes. So this could be acute or chronic. If the acute conditions are usually because of most common or hepatotrophic virus, they are hepatitis A, hepatitis B, hepatitis C, hepatitis E. Of these, the hepatitis A and hepatitis E are waterborne infections which are self-limiting majority of times and severe manifestations seen in very small group of people. The other two types of virus are hepatitis B and hepatitis C virus. These are transmitted via blood and blood products like injections, needles, drug abusers or immoral sexual activities, and it is not and it is even transmitted from mother to child. So the other causes are again drugs can cause this kind of hepatotrophic type of jaundice. Then some genetic disorders which I am not going to discuss here. Here I want to discuss the acute and chronic causes, preferably in adults. Okay, and post hepatic jaundice means once the bilirubin is formed and it is excreted by a bile duct into the intestines. If there is any obstruction, either in the form of stone, in the form of malignancy, then you will get post hepatic type of jaundice. So what are the how we have to deal this jaundice? First of all, when patient comes to you, we must decide whether it is the hepatotrophic jaundice or extra hepatic or pre-hepatic jaundice, because the treatment varies. In case of pre-hepatic jaundice, it is usually hematological or some genetic disease like early Wilson's disease, where you can have a hemolytic type of jaundice. So there we have to recognize the cause and treat the type of disorder in the red blood cell. The most important is hepatotrophic jaundice. The most three important causes, as I discussed, are: first is virus, second is alcohol, and third is the drugs. And post hepatic causes are most commonly due to the gallbladder stones or stones in the bile duct, and maybe some cancers. Okay, the cancers of bile duct or the cancers in the pancreatic head, which can cause obstructive jaundice. So, how the jaundice is manifested? As I told you in the beginning, it could be a simple yellow discoloration of urine. If the jaundice is deepens, then there is yellow discoloration of eyes, and there will be discoloration of the skin. Usually, it cannot be seen in dark skin people, where it can be noticed very early in fair skin people. And associated, sometimes there will be fever, vomiting, nausea, sometimes loose motions. When the jaundice is deepened, then patients can have dark colored urine, there may be itching on the body. When jaundice is prolonged and is entered into the chronic stage, then patient will develop dysfunction of the liver, which results in swelling of the legs, fluid into the abdomen, which causes abdominal distance. When this bilirubin spreads into the blood and there is metabolic dysfunction of the liver, causes ammonia enter into the blood, which can cause encephalopathy. Then post hepatic jaundice, in this case patient will present abdominal pain, that is we call in medical terms as Balearic Colic. Patient will have severe Balearic Colic, there may be fever, there may be vomiting, when on routine investigations, which I will come later. So, this is the why jaundice is very important. If we do not recognize the cause of jaundice and type of jaundice, we will be treating in incorrect way. So, to treat in a correct way, we should diagnose the jaundice. The earliest tests we need to do in case of jaundice is, first of all, we call it is liver function tests. In the liver function test, we will come to know what is the type of jaundice. First of all, there will be raise in the bilirubin. In the raised bilirubin, then there are two types of bilirubin. One is conjugated bilirubin, another is unconjugated bilirubin. The conjugated bilirubin will be excreted into the urine and stools, whereas the unconjugated bilirubin will be only in the blood. So, most common cause for raised unconjugated bilirubin is, apart from some genetic disorders, one important cause is hemolytic anemias. So, it is totally, when there is hemolytic anemia, the treatment is totally different. The second is, along with elevation of bilirubin, there are three enzymes which we should look into, are that is called SGPT or ALT, SGOT or AST, and alkaline phosphatase. In case of viral diseases, that is hepatitis A, B, C or E, the SGPT or ALT levels will be elevated very high. Sometimes they may be elevated to 10 to 15 times also. Whereas alkaline phosphatase is not elevated many a fold in case of hepatotropic viral diseases. The alkaline phosphatase is elevated disproportionately in case of post hepatic jaundice, that is called obstructive jaundice. In that cases, the bilirubin level may not be elevated very high when compared to that of alkaline phosphatase, or otherwise also it can happen. So, once we know the LFT reports, then we check into the simple complete blood picture. where we see the hemoglobin levels, white blood cells levels, RBC type and type of RBCs, which the morphology of RBC tells whether patient is having hemolytic anemia or not. Okay. When there is elevated WBC levels, means there is some infection is going on. So, based on the LFT, how should we decide whether it is obstructive jaundice or non-obstructive jaundice? The next test we do is ultrasound abdomen. In this ultrasound abdomen, we look into the gallbladder, whether there are any gallbladder stones or whether there are any stones in the bile duct or there is any problem at the distal end of the bile duct where it joins with pancreatic duct and enters into the intestine, that is duodenum. Is there any malignant issues at that area? We can have an obstructive type of jaundice. Why should we know all these things? That if it is because of viral or it is because of liver disease, there is a treatment, there is a diagnostic, different way of diagnosis, whereas in case of obstructive jaundice, there is a different investigations we need and the treatment is differ. Now we come to the hepatic. See, and of all types of jaundice can be result because of alcohol also. So, alcohol can cause jaundice at any type, it may be acute or it may be chronic. And another condition which can cause jaundice is any tumors in the liver, that is called a hepatocellular carcinoma. There are many more causes which is beyond the scope to discuss at this level. Now, if it is because of viral, as I told you, whether it is hepatitis A, hepatitis B or hepatitis C or hepatitis E. So, we do a test accordingly, whether it is active infection or chronic infection. So, that is called hepatic viral serology. Hepatitis A and hepatitis E are self-limiting diseases. We do not have to worry much unless there are severe symptoms. Whereas hepatitis B and hepatitis C, with hepatitis B, because of good vaccination, hepatitis B infection are coming down, but not exactly 100% because the vaccination is not gone into the periphery levels even today also. And hepatitis B virus, 90 to 95% of time it is recovers without any kind of treatment. Only 5 to 10% of hepatitis B virus infections go into chronicity, which eventually develop severe liver injury, results in cirrhosis, and in future they can develop cancer also. Whereas hepatitis C virus, which is always manifests in the form of chronic injury. Acute hepatitis C is very, very uncommon. Now, when we diagnose whether it is hepatitis B and hepatitis C, then present day we have best treatment modalities are available. We have very good drugs to treat these two conditions, and we can control this infection. Eventually, we can avoid development of chronicity. Now, when we are talking, then we can talk about the extrahepatic, that is because of obstructive type of jaundice, that is presence of gallstones and presence of malignancies. These are the surgical conditions which needs surgical treatment. Like if there are gallbladder stones or CBD stones, with an ERCP we clear the CBD stones, that is common bile duct stones, and surgically we can remove gallbladder stones, that is called laparoscopic cholecystectomy. If other conditions like malignancies, it will be dealt by oncosurgeon. Now, alcohol is one of the major cause for the development of liver disease. Alcohol majority times results in chronic liver disease, that is, patients will develop cirrhosis of the liver. In the cirrhosis of the liver is shrunken in size, it loses its metabolic activity, then eventually it causes hypoalbuminemia, means the protein which is required for body is gradually reduced, which develops in accumulation of fluid in the abdomen or in the legs. That is called pedal edema or ascites. And eventually, if you don't control this, these patients also will develop malignancy at the end, or they develop end stage liver disease which needs liver transplantation. So, this is how the jaundice occurs and what we are supposed to do. Now, come to the patient's point of view. Whenever jaundice patient recognizes, do not go into panic stage, because everybody influences, especially the neighbors, the quacks, and the myths and beliefs and religious sentiments will eventually lead to have a wrong treatment. As I told you in the beginning, jaundice in case of viral infections is self-limiting. 90 to 95% resolves on their own without any kind of treatment. And alcoholic liver injury, if we convince the patient to stop alcohol intake, the disease severity can be reduced maximally and we can prevent further damage to the liver. So, I want to concentrate more on the management of this jaundice, especially by virus and alcohol and gallbladder stones or common bile duct stones, and because of malignancies. Usually we come across every patient with jaundice, first they go for alternative medicine, which is not correct in patient points of view. Eventually they end up having many complications. They come with many complications in the form of not only because of this viral disease or other underlying disease, because of the medicines which are unknown the content of the medicine, they can cause drug induced liver disease. So, that is which is major problem which we are facing today. So, because of this myths, everybody whether educated or uneducated or because of their personal beliefs, they are taking these medications, eventually they are worsening their own liver disease. So, once when you come to the hospital, you have to meet a gastroenterologist. The gastroenterologist decides what kind of jaundice it is, whether it can be treated medically or whether it needs surgical interventions. If patient needs surgical intervention, the patient will be referred to a surgical gastroenterologist for further workup and treatment. Present day, if there are stones in the gallbladder or stones in the common bile duct, it can be removed by laparoscopic cholecystectomy, and with an ERCP we can clear the common bile duct stones. If it is malignancy, of course, patient has to undergo treatment from an oncosurgeon. Now, come to the jaundice where medical treatments are available. The first of all, hepatitis B and hepatitis C virus, and so these patients needs treatment. Hepatitis B virus, we further investigate whether this patient needs treatment at the moment or little later. How we decides this? We do some serological tests for hepatitis B, that is called whether patient is active infection or inactive infection or viral load. If the viral load is considerably high, then we look into the liver function test. If in acute phase, we do not treat the hepatitis B. In chronic stage, that means when the disease progressed to more than 3 months, then we need to treat hepatitis B. So, depending upon the viral load, we treat hepatitis B with simple medications. At present, the medicines should be taken for longer duration. Maybe in the future, we are getting short term courses, so which are under investigations. Next is hepatitis C virus. Hepatitis C virus invariably it results in chronicity, needs every patient should take treatment. So, hepatitis C again is several types. Hepatitis depends upon the genotypes, type 1, type 2, type 3, type 4. Again there is sub genotypes of A and B. Why we have to know it? The treatment type and duration varies accordingly. For hepatitis C nowadays we have injection free treatments. Now only it can be controlled by tablet forms, which are now started available in India also. Unlike hepatitis B, the hepatitis C treatment is of 3 to 6 months duration only. And hepatitis A and hepatitis E, as I told you, are self-limiting disease. They do not require any treatment, only observation is sufficient. Then when once the complications develop because of liver damage and because of the chronicity, patient develop cirrhosis of the liver irrespective of etiology. That means irrespective of the cause. It may be virus, it may be toxin, it may be alcohol, it may be some genetics, or it may be autoimmune. Once the cirrhosis stage develops, usually it is irreversible. It results in the complications of the cirrhosis, like patient can have ascites, or patients can have blood vomitings, patients can have encephalopathy. That means altered sensorium, patient may go into the coma, and at the end they develop cancer also, that is hepatocellular carcinoma. When once patient develops any of these stages like blood vomitings or encephalopathy or fluid into the abdomen, which can be controlled medically by giving medications. If again the cirrhosis of the liver is of 3 stages, A child, we call it as child A, child B, child C, depending upon the number of complications associated with it. Complication of cirrhosis medically only to control the complications, but the treatment will not reverse the cirrhosis. Ultimately, when end stage liver disease happens, all these patients have to undergo liver transplantation. That is the only answer for end stage liver disease. Now, come to the diet in case of jaundice. There are lot of myths regarding the diet in case of jaundice because of cultural beliefs, religious beliefs, because of myths. So, number 1, there is no restriction for any type of diet in case of jaundice. Patient can take every kind of food unless patient feels he has nausea and vomiting. In acute phase of jaundice, patient should be encouraged to take more carbohydrate diet, that is fruits, fruit juices, rice, etc., etc. And there is no necessity to stop giving patient or any kind of vegetables or vegetarian eggs or non-vegetarian. Patient, if tolerate, he should take all kinds of vegetables and non-vegetarian also. Like that, patient need not restrict intake of fatty foods also. Fatty food should be reduced in case of cholestatic phase, that is in case of obstructive jaundice patients only. Even if patient able to tolerate, patient should able to take all kinds of foods. Okay, then there is no necessity to stop adding turmeric into the food. So turmeric will not cause jaundice, and majority times these patients will be live on only rice and curds. That really reduces the patient's tolerance, immunity and recovery. It delays the recovery phase. I always encourage all my patients who don't have severe issues except only jaundice, if patient able to take food, if able to tolerate, I always encourage to take all kinds of food. Next is, majority times we don't have to treat jaundice like hepatitis A and hepatitis C, for the matter hepatitis B also, because these are, they can resolve 90 to 95% times within 3 to 6 weeks. In these patients, you have to encourage to eat healthy food. Then another important thing is, whatever type of jaundice, one should not take alcohol in this period unless patient fully recovers. Even he should not indulge in social alcoholism. So to conclude, when patient comes when patient notices jaundice, he should first meet a gastroenterologist to know what type of jaundice it is. If in adults, usually it is because of viral infection, alcohol. So first of all, stop taking alcohol and wait and observe how the jaundice is progressing. If it is not causing any side of any other complications, wait and watch, have healthy food, the jaundice subsides on its own. Next is, in case of jaundice where the patient needs surgical intervention, should go immediately to a surgical gastroenterologist. Once the patient recovers from jaundice, there will not be any residual disease in case of acute hepatitis. If it is hepatitis B, now we have vaccine available. The patient, if is married, you have to check for the spouse hepatitis B. If he or she is negative for hepatitis B infection, should be vaccinated, and all the family members should be vaccinated, because hepatitis B vaccine, once you have taken it, you will not get hepatitis B infection again. Then always take clean, safe water. We don't have to take portable water. We don't have to take this bottled water every time. Simple heating and cooling is sufficient to remove majority of the infections. So clean water, and wash all vegetables cleanly before cooking. Then do not take roadside unhealthy foods. Avoid cold roadside foods which are sources for hepatitis A and hepatitis E. One more point I should mention to you is hepatitis E in case of pregnant ladies should be very cautious. This group of patients can have more complications than the routine normal patients. So, any pregnant woman when diagnosed having hepatitis E infection should meet the gastroenterologist as well as the obstetrician and should be under regular follow up. So, having healthy habits, having taken clean and healthy food and taking good nutrition during the period of jaundice prevents many complications and helps in early recovery of the disease. We don't have to worry because of jaundice, and do not go to the alternative medicines and age-old customs which further damages the liver.